Aortic aneurysm. An aneurysm is a localized sac or dilation formed at a weak point in the wall of the aorta. It may be classified by its shape or form. The most common forms of aneurysms are saccular or fusiform. A saccular aneurysm projects from one side of the vessel only. If an entire arterial segment becomes dilated, a fusiform aneurysm develops. Very small aneurysms due to localized infection are called mycotic aneurysms. Historically, the cause of abdominal aortic aneurysm, the most common type of degenerative aneurysm, has been attributed to atherosclerotic changes in the aorta. Aneurysms are serious because they can rupture, leading to hemorrhage and death. There are two types of aneurysm: thoracic aortic aneurysm and abdominal aortic aneurysm. First, we will see the thoracic aortic aneurysm. Approximately 85% of all cases of thoracic aortic aneurysm are caused by atherosclerosis. They occur most frequently in men between the ages of 40 to 70 years. The thoracic area is the most common site for a dissecting aneurysm. About 1/3 of patients with thoracic aneurysms die of rupture of aneurysm. Clinical manifestations. Symptoms are variable and depend on how rapidly the aneurysm dilates and how the pulsating mass affects surrounding intrathoracic structures. Some patients are asymptomatic. In most cases, pain is the most prominent symptom. The pain is usually constant and boring but may occur only when the person is in supine position. Other conspicuous symptoms are dyspnea, the result of pressure of the sac against the trachea, a main bronchus, or the lung itself. Cough, frequently paroxysmal and with a brassy quality, hoarseness, stridor or weakness or complete loss of the voice, aphonia, resulting from pressure against the left recurrent laryngeal nerve, and dysphagia, difficulty in swallowing due to impingement on the esophagus by the aneurysm. Assessment and diagnostic findings. When large veins in the chest are compressed by the aneurysm, the superficial veins of the chest, neck or arms become dilated, and edematous areas on the chest wall and cyanosis are often evident. Pressure against the cervical sympathetic chain can result in unequal pupils. Diagnosis of a thoracic aortic aneurysm is principally made by chest X-ray, transesophageal echocardiography, and CT. Medical management. In most cases, an aneurysm is treated by surgical repair. General measures such as controlling blood pressure and correcting risk factors may be helpful. It is important to control blood pressure in patients with dissecting aneurysms. Systolic pressure is maintained at about 100 to 120 mm of mercury with antihypertensive medications. Example: hydralazine hydrochloride, esmolol hydrochloride, or another beta blocker such as atenolol or timolol maleate. Pulsatile flow is reduced by medications that reduce cardiac contractility. Example: propranolol, that is Inderol. The goal of surgery is to repair the aneurysm and restore vascular continuity with a vascular graft. Intensive monitoring is usually required after this type of surgery, and the patient is cared for in the critical care unit. Repair of thoracic aneurysms using endovascular graft implanted percutaneously in an interventional laboratory, cardiac catheterization laboratory, may decrease postoperative recovery time and decrease complications compared with traditional surgical techniques. Thank you.